Vasovagal syncope, or fainting, can occur in the context of common dermatology procedures. It is important to know how to manage it. How does it happen? Vasovagal syncope occurs as an overreaction to certain triggers. Before syncope occurs, there is a sympathetic flight or fight response. Yet, when syncope actually occurs, there is a sudden reversal of symptoms leading to slowed heart rate and dilation of the blood vessels in the lower extremities. This results in reduced blood flow and oxygen to the brain and a loss of consciousness. Most cases of vasovagal syncope are harmless. Some common triggers include injection of medicines, including local anesthetics, painful stimuli, seeing needles or surgical tools, sensation of cosmetic filler injection, seeing a wound or blood, emotional distress, low blood sugar in diabetics, and prolonged standing or sitting upright. The following are some tips to prevent a vasovagal episode. Patients should be well hydrated and have eaten a recent meal when possible prior to the procedure. In anxious patients, draping a towel over their eyes so that they do not see any blood, tools, or biopsy specimens can also be helpful. The most important technique to prevent syncopal episodes is performing procedures while the patient is in a supine position. Some people with vasovagal tendency claim sensitivity to the effects of epinephrine. In these patients, utilizing plain, lower concentration 1% lidocaine and injecting it slowly with a small gauge needle, such as a 32 gauge, can be helpful. If the patient is very anxious about needles and pain, try preoperative numbing cream. If the surgery or procedure is prolonged, be sure to elevate the patient gradually from the supine position, checking in to see how he or she is feeling, and guide the patient to slowly rise to a full upright position. Some common warning signs that can come before a vasovagal episode include anxiety, lightheadedness, fast heart rate, palpitations, sweating, and nausea. Less commonly seen signs are confusion, headache, paleness, heightened awareness of senses, specifically hearing, and feeling warm. When a vasovagal syncope episode happens, first, stop whatever procedure you were doing. Keep calm and enlist the help of the other staff with whom you are working. A team approach will expedite your patient's return to normal. It is important to never leave your patient alone and to continue talking to them throughout, explaining calmly and in simple terms what you and the team are doing. Stop any bleeding and bandage the surgical site. Your main job now is to stabilize your patient. Then, lay your patient back into Trendelenburg, with their feet raised higher than their head by at least 15 to 30 degrees, or at least elevate the legs to facilitate blood flow to the heart. Loosen any restrictive clothing. And remember, a syncopal episode usually only lasts a few minutes. Next, obtain and document vitals and the time they were taken. This includes blood pressure, pulse, respiratory rate, and glucose level if indicated. If there are no breath sounds, check the airway. If there is no pulse, start CPR and call 911. Some tips for relieving syncopal symptoms include placing ice packs or a cold, wet towel on the posterior neck and forehead, and or directing a low-powered fan towards the patient's head if available. If the vitals are stable but the patient feels nauseous, turn them in the left lateral decubitus position, laying on their left side, and encourage them to let themselves vomit if needed. Offer juice or water via a straw only if the patient is fully alert and not nauseous while still laying down. Recheck and document the same vitals as before. Also, record in the patient's own words how they feel now. Once the patient is stable, which is usually after about 15 to 30 minutes, slowly elevate the head of the bed and position them to sitting. Allow the patient to get up when they feel ready. Getting up too quickly increases the risk of another syncopal episode. If the vitals are not improving, the patient feels worse, or is displaying seizure-like movements, call 911. Make sure your patient has fully recovered before letting them leave your office. Before discharge, obtain and document another set of vitals, which should be normal. If you are concerned the episode was not just a basic vasovagal syncopal episode, send the patient to an emergency room or suggest follow-up with their primary care physician for further evaluation.